Sure.
Give the guys, come to us with some kind of recommendation. Thank you, guys. Mr. Manager, any other items to come up?
No, sir, just those other, those two budget amendments, and Lori will touch on those real quick.
A couple more budget items, Mr. Chairman, we have not talked about that I think we were going to talk about. One of them was the reach request.
Okay. They did come to us with a request, Derek, what was, $50,000?
What's our community fund for?
And there was something else we had a question. Oh, you want me to call Mark Meadows about the,
MPP.
MPP, that federal, didn't cover that. We just got
Yeah.
about that.
Right, they're having some hard time with that.
But Commissioner Hagan mentioned, consider taking a look at that.
Right.
If they don't come through, then we might need to consider it.
Remind me, it was like 24,000 total actually we had to pay in for the management of the HUD, right? So could you look at, Mr. Chairman, could we look at doing maybe 6 months to get, because that money runs out June 32. So if we look at 6 months and maybe give the time for the federal, we do anticipate that might get some reimbursement. We don't, I wouldn't bet my stock on that.
I'll be happy to talk to Congressman Meadows and work on that, and Ron, maybe you and I can both.
I had approached him about this,
You already
I
got
had discussed with him, I discussed if you were aware of it.
Yeah.
And he sent me an email back on it, but, that he would definitely make this priority, but I've not heard the outcome of
But it ended on June 30th. I think, would it be prudent for us to go ahead and look at, and let the county manager look about at least probably $12,000?
Give them 25,000 in current year.
it.
25 in with 2 different times.
Yeah.
So,
2 different times, and a total of 25,000.
so I'd look at maybe the 12, Mr. Chairman, and see what, that'll tide them over until maybe we can work out something with the Fed, because it is, and even the congressman, I think, agreed that they should be, and he didn't know what the glitch was, but there's a lot of glitches in the federal government.
It's more 400 and something glitches.
Yeah.
And that's in next
Talking about doing it
FY.
now or next year.
Well, what I recommend, have anything left of contingency from this year, and to move it over, and not affect the new budget.
I did, we got a little bit there, and then I think you gotta put that in with your whole budget, and just take a look at the whole thing.
But you're saying this year continues.
Well, I know we have a little money left. I know it's not. I'm just saying.
We're not at the end of the year.
Yeah. So if there's any money left in there because this is important, we agreed to before we made these payments to them. And it's 100 and some odd, 160 some odd families this affects. So even though it's not, we can't afford it all, I think for that amount of money, it's important. At least we can get it straightened out, hopefully.
Okay. Anything else on the budget?
How many employees this year?
One and 2/12.
Yeah. The 2 months employee direct, possibly, and then the other one would say mechanic.
And then the SROs we voted on in January, is that already picked up?
Yes, already.
Yeah, that's in budget.
Possibly. We haven't talked about, when we're talking about some of those
We can absorb
But
that.
that's coming out of your.
That's no new money. We can absorb
This year.
or next year. That's no new money this year or next year. See, we budgeted that $125,000 ambulance in our out of our operating expenses. So removing that, what Mr. K brought to us today is $115,000 to employees on an ambulance truck. That's all in the operating budget. None of that was taken from fund balance. So that's just like saying that 125 is gonna be in there this year, next year, next year, next year, and we're still staying at 45,521, because that's built into our operating budget. So that's there. So in other words, we can support that $115,000 of those employees and be 10,000 to the good year after year after year after year.
That's a big cushion.
Yeah, that was a good. And like Mr. Cave also alluded to, there's some expenditures in his budget this year. Like I said, we're 10,000 to the good on that ambulance. We've got a roofing project for the base in Anahala that's been included in that budget. And that's not going to be there next year because, again, it's one time, but it was put in the operating budget. So there's monies in there, and like he said, he was going to take a look at some of the overtime or salaries and things. There's monies in there that I feel that we'll be in good shape next year too. In there.
Well, that's good if we're only adding employees. I mean, we need employees to provide the level of service that the taxpayers expect. But right now, in salaries and fringe benefits, I think out of our budget, we pay about $21 million. And that's a big chunk out of a $45 million budget. So yeah, I'm for all keeping, there's no raises for any of the employees. I'm for keeping a very well-paid, minimal staff, whatever it takes to provide a certain level of service. But when you figure up your fringe and your salaries at $21 million, that's almost half of your budget for your staff. That's a big number. So we need to limit.
That you run a service or an organization or a business that's employee intensive.
It's all that's what it is. And we need to take care of the employees we've got, but limit to just exactly what we need to provide the service. And we do have great employees. I'm glad to report that.
Just one other thing I'd like to bring up, Mr. Manager, Mr. Chairman, is about the community care clinic. You know, last year we funded the community care clinic at $40,000. A little history on the community care clinic. It was funded for the first 3 years on a grant from the state of North Carolina, and it was a satellite clinic of the Highlands Free Clinic for the people. Highlands Free Clinic, of course, is self-sustained and self-supportive through large donations. We're not privileged to have those donations. We did agree. I guess there's some disagreement on did we just we agreed to try to help them for the 3 years max. We did help them 1 year for the 40. The patient count last year is around 1,000 people, around 1,000 visits. This year they're overwhelmed as usual. There's a lot of uninsured, a lot of low income in Macon County that use this clinic. I don't know how much money gets saved overall by some of these problems that they found and getting treatment for. It saved the system a lot of money. But this year, knowing that we can't even fund the 40, I don't see no way we can do that. But I would ask Mr. Chairman that have the county manager look to see if we could, if at all possible, for the patients they serve and for the money that's outlaid. If y'all never been to the community care clinic, you need to make a visit, number one. And but I would ask, and I can't put an amount on it, Mr. Chairman. If it was up to me, we'd try to find the $40,000. But I think what we've talked about and looking through the total budget, that's unrealistic. But I would ask that with the consensus of the board, to have the county manager look at that and see if there are some funds that we can help. We want a 3-year commitment. That's what it's going to take to make it sustainable. They are working hard. They've got a good board. They have very dedicated volunteers. It helps a lot of people making it. So
At the end of 3 years, want to keep it up.
well, they hope to be sustainable. They're looking at grants. We've applied to the Secretary of State's grant.
Do they file insurance?
The Attorney General, yes,
They do file
but
insurance.
most of them very few uninsured. They don't have insurance.
Uninsured, very free insured.
They don't have no. They treat the uninsured.
Yeah, that really, big picture here, you know, when people sign up for health insurance, I mean, whether you're for the Affordable Care Act or not, and I obviously have my differences with it, but in theory, you've got people that are uninsured that should be insured.
And we did, and they did go back and check the records, and they got a lot of these people insured. They've been busy.
Which means their insurance should be paid.
Yeah. But some of them, they're in that gap. There's a gap there that they all get caught in.
Well, the only gap you got now is people that make single, that make $11,409 a year, less than $11,409 a year.
We still see a lot of children.
They don't qualify for
And they see a lot of children there that's not, and as the Medicaid requirements have changed too. So I would just ask that we look to see if there's somebody there to help them, and hopefully, we're really working on a grant from the Attorney General's office. We've met with him 2 or 3 times, and hopefully, Miss Smoot is in charge of that grant, and she's our newest best friend. So we're hopefully that'll come through, and that would really help them over but their income is still, of course, as everybody is in anything like this through this recession. It's been tough, but they continue to serve the folks in Macon County need service. So I just ask we look at it.
Mr. Chairman, I'll make a motion to approve both budget amendments.
Second.
Okay, we have a motion second to approve budget amendments scored 177 and 178. And these have voted for sometime. Any discussion on that? Yeah. Let's see what we got.
Didn't cost the county anything, right, for it?
No county money.
Ron, you? Any other discussion or questions? Hearing none, all in favor say aye.
Aye.
Opposed? That motion passes. Mr. Manager, that's all the business I have.
Mr. Chairman, we could, request a closed session for attorney's client privilege.
Motion to go into closed session very quickly and adjourn very quickly, Mr. Chairman.
You anticipate any action after this closed session?
No.
No? Okay. For a discussion with her. All right, motion to go into closed session?
And he said-
I tell you.
Quickly,
All-
yeah.
Yeah. I'm not gonna go do that.
1 o'clock.
Were you gonna get one?
Soccer game.
Highland
They're right up the road. That's what
Let's
Oh,
go.
okay. All in favor of closed session, say aye.
Aye.
Let's, Derek, we're gonna move across the hall.
Yeah.
I mean, I guess
That sounds good.
We'll be right back. All I need is a motion to adjourn. Second. Second by Bill. Yes, sir. Where's Mike go, right?
Mine.
Derek, you feel like you have adequate, instruction?
One thing I was gonna ask you, Ron participated. Get Ron to sit. He probably remembers. He may as well.
You guys adjourned, right?
We have a
Okay.
motion by Tate, second by Bill to adjourn. All in favor?
Aye.